Senator Welch and Ms. Umberger, you testified it feels like your kids were serving time alongside you and being punished with you.
Yeah.
Can you elaborate on that?
Yes. So as we have started the reunification process, we've been in it for about a year now. I've got to know them pretty well. And they're sitting around, the dinner table, and something will trigger a memory. And do you remember that time when Miss So-and-so did this to me, or Miss So-and-so did that to me? Do you remember this? And they're like, yeah, that was tough. And then, yeah, Mom, did you know that Eli wasn't allowed to eat fresh food? He only could eat leftovers, and he had to stay in his room. It's as if my children were also doing time. Some of the things that they were saying are the things that I experienced as well. It's like he was being punished for being in foster care, like as if he had been bad.
Well, in fact, as this subcommittee has found through our work investigating the conditions faced by children in foster care in Georgia, those conditions do mirror detention conditions in group homes, for example. And in fact, we've even seen suggestions by some senior officials in the state of Georgia to place foster children in juvenile detention facilities for a lack of adequate placement. So you were incarcerated, forced to endure this indescribably horrific experience as a delivering mother, all the while your children were also being punished. I appreciate you helping the public to understand how you're not the only one harmed by the way these situations are handled and managed. I want to focus on the fact that you testified prison staff told you you were required to undergo a C-section, even though you expressed your desire for vaginal delivery, correct?
Yes, I wanted a natural birth. I knew I could have a natural birth, considering I'd had a VBAC, which is vaginal birth after cesarean. I'd already had a successful VBAC, so I knew what was possible as far as medical. I knew it was medically possible for me to do this. But I was scheduled for a cesarean, and then it was placed on my credit. I was also billed for it as well. So, yeah, that was something I was like, I don't even have control over my own body. Like, the judge said nothing about that when he sentenced me to prison. There was none of that mentioned.
So you were required to undergo surgery you didn't want.
Yes, sir.
And then you were required to pay for it.
Yes, sir.
Required by the state.
Yes, sir. The Department of Corrections. Georgia Department of Corrections.
Dr. Suffern, the subcommittee received 7 other reports, and I want everyone to know we've been looking at this for just a few months, and this is a relatively small team here. So the fact that we've received 7 other reports from formerly incarcerated women that they were also told by prison staff that they were required to undergo a C-section suggests to me that this phenomenon is much, much more widespread. Is it medically sound to require incarcerated pregnant women to undergo a C-section?
No, sir. Thank you for your question. And to elaborate, having a routine policy, whether it's a medical policy or a custody policy, to require women to have a C-section as their mode of delivery is medically unsound. Best medical practice is that this should be a decision that is between the patient and their obstetrician or their midwife, their caregiver, based on their circumstances. And if someone has no medical indication for a C-section, a vaginal birth is the preferred option. It is the safest option, as was the case in Ms. Umberger, who has already had a vaginal birth since her cesarean section. It is not a sound, evidence-based, or safe policy to routinely schedule C-sections.
A lot of jails are using contract arrangements for medical services, correct?
Yes.
And what's more lucrative from a billing standpoint, vaginal delivery or a C-section?
My expertise is not necessarily in billing, but major surgery does cost more money than a vaginal birth.
Well, it may be worth looking into whether there are corrupt financial incentives in some cases that are driving these facilities which control the course of treatment for patients in their care toward more expensive, more invasive, and potentially more complicated surgeries. We have identified more than 100 reports nationwide that pregnant and postpartum women in prisons and jails were medically neglected. Ms. LaBoy, you testified that when your daughter started to experience labor symptoms, including abdominal pain and discharge, the medical and prison staff repeatedly dismissed her concerns, just giving her a heating pad, telling her to, quote, just lie down. As a mother, how did it make you feel to learn that that is how your daughter had been treated entering labor?
Thank you for that question. It was hard, being that I kind of talked to her on the phone, like mostly all the time before all this took place. I think that there's no word to explain how I felt as a mother. This was my first grandbaby. I became a grandmother while my daughter was in prison. And it should have been something that she should have been born in a hospital. She should have been born in a safe environment, not in unsanitary place, not into a toilet bowl. I don't think any mother would want to hear that her granddaughter or grandson was born into a toilet bowl. It was very painful to know that they disregarded my daughter's dignity, her well-being. It hurts a lot to this day.
Dr. Suffren, I presume that giving someone a heating pad and sending them back to their prison cell to lie down is not the standard of care for a pregnant woman entering labor.
No, sir, it is not. And especially in the case of Ms. LaBoy's daughter, it sounds like she was preterm. And the signs and symptoms of preterm labor can be very subtle, very subtle. Some cramping, light bleeding, change in your vaginal discharge, very subtle, and they require urgent attention from a qualified provider and not a heating pad.
Ms. Umberger, you described how after you gave birth, a male sergeant refused to leave your hospital room and watched while a nurse took care of you.
Yes.
How did that experience impact you at the time and now?
I still remember his eyes. I was in shock when he refused to leave the room. You know, I was paralyzed from the waist down. I had been in surgery, you know. Nothing about me even showed any past violent behaviors or anything like that, you know. My dignity was taken down to the knees of vulnerability. It's like I was not a real person. Like, you know, and the fact that he was just looking at it, I still remember it to this day like it was yesterday. Nobody should ever have to go through that, ever.
I want to thank from the bottom of my heart our panel today. And Dr. Suffren, of course, we're grateful for your expertise and for the precision and the research and evidence-based information that you've shared with the Senate today. And I hope you won't mind if I extend my deepest gratitude to Ms. Umberger and Ms. LeBoy for speaking today in public in front of the nation on something so deeply painful and personal for you. And before I wrap up and summarize what I think we've learned and where we go from here, just like to offer each of you the opportunity, if you desire, to say anything you want to share with the Senate, with the public, with the nation about what you've been through and what you think this country needs to do to change for the better. Ms. Umberger, we'll begin with you, please.
Well, first, as I had described earlier, being in that basement and looking out that caged window, wondering if anybody cared, I think what you've done here today and how you have brought the other members of the Senate here to listen and actually show that they care is a great start. I never thought I would be here speaking with you. And just when a woman is giving birth, even though the paper says she's an incarcerated woman, morally know that she is a mother, she is a sister, she is a daughter, she is more than a number and should be treated as such. I did this today for the women who are behind those walls, who are still actively going through things that we described here today. And our country it needs to be better. It should be better. I was promised better. So, thank you.
Thank you, Ms. Umberger. Ms. LeBoy.
Thank you. Just want to say before I give my last statement, it's harder to know that my daughter went through this, but sitting here next to someone that physically experienced this makes me emotional. No family, no mother should go through this. They did not receive medical care. My daughter didn't receive medical care. They were ignored, treated like animals. And I wouldn't even say an animal because I have a cat, and not even cats give birth by themselves like the way my daughter did, like an animal, like somebody disregarded her. No family should endure this. No mother should endure this kind of pain. They were ignored. Their human rights were just not protected. Their dignity was taken. No children should have been born in a toilet bowl. And I want to thank you. I want to thank everyone that's here today because it shows that there is hope for a change, that, the prison could be better, that no family have to deal with this ordeal, this kind of pain. We just got to do better. I hope that this makes things better, a spark for a change. And I just want to say that I thank everyone that's here, everyone that's listening, that's watching, that's going to watch this down the line, that no matter if you're behind bars, they should have the same medical treatment after they were home. they should have the same rights, and they should protect the basic human rights. They should not be treated like this. We need to do better in the prison system.
Thank you, Ms. LaBoy. And Ms. Umberger, I just haven't been able to get out of my mind the part of the story you shared with us just after you delivered, just after your surgery, and you're taken down into the basement, into a caged room, subjected to indignity. And you told us how you were sitting there, laying there, just wondering if anybody knew that this is how human beings are treated in America, and whether anyone would care, and how alone you must have felt, and how you just said a moment ago you felt betrayed. You were promised better than this. And I right now, as we sit here in this wood-paneled chamber, there are women on prison wards, laboring, bleeding, calling for help, right as we speak, facing the same kind of inhumanity and neglect that Ms. Umberger did. Happening in jails across this country with taxpayer dollars. Makes you think about how the United States goes around the world lecturing other nations on human rights. But how can we hear what we've heard today and accept that even basic human rights are being protected in our society? And I will say, Dr. Suffren, that despite the strange moment earlier with my colleague, I think that there is the potential for bipartisanship. But it takes the courage of this kind of testimony for politicians who may not naturally be sympathetic to hear directly from people who have been through this kind of thing, what it means to get it beyond numbers. And that's why it's so powerful what you've done today. And there will be hundreds of thousands or millions of people across the country who will see tonight your testimony and understand better what's being done with their money in their name, supposedly consistent with our Constitution when clearly it's not. And this won't be the end of this subcommittee's engagement as we continue this inquiry. Thank you all so much for being here. The hearing record will remain open for 1 week for statements to be submitted into the record. Questions for the record may be submitted by senators by 5 p.m. on Wednesday, August 7th. Hearing is adjourned.